Initially, let me give a brief overview, okay, about the orientation, about the internship, how it will be, what to be done, how to be done, and after that we will discuss some more things about with the experts, subject experts. After that, we'll have an interaction session, one-to-one, like interaction session of all your doubts and anything you have, you can discuss. Okay, so I have not prepared. First of all, I have not prepared anything for this session. So whatever it's going to be impromptu. I'll be just sharing my own experience. I had a wonderful internship. I had wonderful internship at Video Hospital, Bowring Hospital, Vani Villas, and Minto hospitals. I got to learn from the best. I got to work maximally. Okay, so I would share in rather than telling some philosophy or something out of the pocket. It's a more relevant. If I say my own, your own seniors experience, if I share, that will be more pertinent, and also you can connect it and relate it better. Oh yeah, if Kishan has done like that, I can do better than that. Yeah, that's the way we connect, and we try to compare. Okay, so I thought I'll share my own internship experience with you. So I summarize this internship as 4 P's. Okay, too easy to remember. Because entire internship can be summarized as 4 P's. First and foremost is practice. What we need to do in an internship is practice. What to practice? The entire 4.5 years, we gained lot of knowledge, theory books, so many clinical postings, this, that, okay, vivas, so many theory knowledge we have gained. Okay, now this is the time, this 1 year is the most crucial and very valuable time. Put this knowledge into action. Okay, that's how we practice, to put our knowledge into practice by working or bringing the knowledge into action. That's the first thing we'll discuss. Second thing is what we do. What's the most interesting part of internship is procedures. Am I right, Ashray? Law in pediatrics, a lot of procedures. Maybe some IV cannulation. It may be pericardial, like what to say, paracentesis, pericardial effusion drainage, RS tube, and ABG, and so many procedures are there. We'll discuss about that also. So the internship is very interesting. Okay, if you get a good PGs and all in your unit, you will be very lucky to do a lot of procedures. We'll discuss about that, how to do procedures, how to get more opportunities, how to butter the PGs and get more opportunities. That we will discuss. And after that, third thing is performance. Okay, what do you mean performance? Performance is, you see, medical profession itself, you will come to know this is whatever we know so far is the only theory knowledge. Okay, but in reality, this theory knowledge is not going to help much in our profession. Okay, what's really helpful is the management skills. How do we really perform with our seniors and consultants? Second thing, how do we perform with the patients? Most importantly, with the patients attenders. How do we manage them? How do we behave ourselves? Or what are etiquettes? These things are really matters. So we'll discuss about that. And fourthly, nowadays it has got more significance in recent times. In our times, we were not very serious. I simultaneous prepare for entrance exams. Whatever entrance exam you are aiming at, how can we? Because years our time is very, very crucial. Every year is we can't. So now there is a trend. Soon of internship, we get a PG entrance, PG seat like that. So how can we do that? How can we achieve that? We all achievers with us today. Dr. Balaji, maybe Dr. Ashray, everyone, all of them have got PG seat in the internship along with working. Okay, along with working. So we'll just all these 4 points. First thing is practice. See, we have attended so many clinical postings, and we have got the best of the lectures from all the teachers. So now we have a thorough, sound knowledge. Okay, but we are kind of clueless or perplexed how to really put them into action. Okay, when we go to now we are a doctor, so you'll be wearing the apron and the steps, and you'll be going to the wards or the OPD. Everyone consider you as a doctor. They don't know. Okay, you are just a trainee or so. They consider you. So your responsibility and what to say, your personality, everything will be like a typical doctor. Okay, so in fact, for us also, we had some really put into action. We didn't know. So everyone will be having this confusion or dilemma. Okay, so how to make use of this? Okay, these scenarios. See, for example, in the clinical postings, we might have learned, okay, the hernia examination or varicose vein examination. In a group, we would have learned along with our friends or unit mates, or some seniors would have taught, okay, something we would have remember. But now what happens? You will be the sole in charge of a ward. You will be the in charge of a surgery ward or medicine ward, or maybe the pediatrics ward. Now, what they expect is you to in the OPD, another your colleague may admit one patient, okay, for the next day's surgery. The patient arrives to the ward. It's your duty to examine the patient, take proper history, okay, and proper examination, and come to a conclusion. Check whether all the relevant pre-op investigations are there or not, whether the results are normal or not. Okay, all these things should be done by you. Okay, you know all these things. So the best way is to go attend the postings or start a posting is to prepare and go a little bit in that particular department. What expected? See, I would give an example of surgery department. In a surgery department, common cases in different places, it's different. Okay, for example, in Bangalore, it may be like the thyroid or varicose veins. So we should know the examination of those cases in detail. Okay, and also salient history. It will not be very detailed history like we used to take in the final year and all. That much time we will not be having. So, but what are the important points which are related important for the diagnosis? And most importantly, now you are like a surgery, you are a surgeon now. Okay, so what's important for the surgery? To do the surgery, what are the history important? What are the examination findings important that you need to or that you should mention in the case sheet? Okay, and varicose veins maybe. Okay, what is the course of whether it's the great saphenous were involved or the short saphenous vein, which limb is involved, whether the perforated incompetence is there or not. All these account for the surgical what is the surgery we take up. If there is a perforated incompetence, we do some different procedure. If there is a femoral SFA incompetence, we do some different procedure. So even a consultant will not have so much time to examine in detail or do the personally. So he'll be totally dependent on you, the first year resident or the interns. Okay, if you step up, you can become the first year resident also. So your findings will be so much valued in that during that time. So we should be very much thorough in that. So how can you go before to the surgery posting is or to the medicine posting is to know the history taking properly and the proper, more than that, proper examination of each case. That's the one thing you should know. Okay, and there when you go, you take the help of the senior in the beginning. He will tell you some protocols, unit protocols, what all to be done and all. Accordingly, you'll be working under the supervision of your postgraduates. Okay, nothing. See, you are not responsible for anything. You are under the supervision. You are a trained. So you are the supervision of the. You are under supervision of the consultants. Also, will be helped or guided by the postgraduates. You are not at all responsible for any of your deeds or misdeeds. So be bold, be confident. Okay. And one more my tip or suggestion from the experience is whatever you are doing, whatever you have done, please inform it to a senior. You may be very confident enough or you may be capable enough to manage any situation or anything. But to be on the safer side or to make it a better, always inform it to a senior. What are your responsibilities are done there. Okay, then he may tell you do that, do this, do that. Then if you may do the same thing, but still it's always make it a habit or make it a note that always you coordinate and inform the things to your senior, immediate senior maybe, or if you think yes or great mercy, you inform it directly to your consultant in charge. Okay, by this half or risk, half of our tensions can be reduced. Okay, this is about the practice. Whatever the simple thing, whatever the knowledge we have, you put into action in all possible ways. Okay, in all the departments. It's about the practice thing. Second thing is the most important. That is the procedures. I would like to tell some of the secrets here. See, when my own experience. When I was in final year only, fourth year MBBS only, I had so many surgeries. Okay, lipoma, excision, and the sebaceous cyst, all those things. And in the big lipomas, I have excised. Okay, that's because see, no one will give you any opportunities because everyone wants to do that for themselves. PGs maybe they want to do, they'll be getting much opportunities, so they'll be wanting to do for themselves. When the consultant sometimes, if they don't trust you so much, they will think that if something happens, even the skin suturing maybe. See, signature suturing is the signature of a surgeon. What we do inside, nobody knows or nobody understands. Okay, nobody in. But what is really evident to the patient is the suturing. If it is nice, the operation is very good. If it's good, not doesn't look good, then the operation is bad. So, and the blame is always on the surgeon, not on the intern who did or resident who did. So, the first and foremost thing, any surgical or any department for that matter, is to gain the trust of a consultant or the senior. Okay, that can be done by working very sincerely and dedicatedly. They'll see. Don't think that if you work in front of them only, they will they'll be happy or no, nothing like that. Every door, every window, every wall of your ward, OPD, they have ears and eyes. These ward attenders, sisters, all you are to the consultants. You may not know. Okay, you'll not realize. Okay, once the consultants go off, oh my God, they went off. Now I am free. I can relax. Okay, that should not be the attitude. Even when they're in their absence, it's for you to learn. Okay, if you don't do, also work will be done. But if you want to learn, if you want to gain skills, this is the time. Now nobody will be there to tell you anything. Yes, I can experiment anything. Okay, now you yourself go to each patient, to do whatever you want, or what are the roles assigned to you, what are the duties assigned to you. Please do that. Okay, and whenever the seniors are there, see today, for example, see Riles tube catheterization, and there are the common procedure, for example, and IV cannula insertion, and what's the ABG taking from the radial artery or femoral, maybe, or some veniscence, or these are the very common procedures done by the junior most in the ward or the thing. So all those things, what you can do is either observe or see once or learn from the seniors. Okay. Or second thing is, most of the places nobody will teach you. My own example, when we were posted in ward, first day, posted in Oxford, 40 patients are there. Ours because bird and largest in India. Okay, so 40 patients at a time, and nobody is there. It's under the control of plastic surgery. So plastic surgeons are all busy in the OTs, and 4 interns take care of the entire ward. That was a scenario then. Then sister come and tell, sir, 40% burns patient is there. We need a venous cut down for that, venesection for that patient. Maybe survived. What is this? I don't know what to do. Then my friend went and asked inside the OT, like, sir, sister is asking for venesection. What to do? Do it, no venesection. They're super specialists. They're least bothered about all small procedures and all. Okay, and do it. What to do? Okay, then okay, we were we opened the YouTube and opened on video. He showed me the YouTube video, like how is the venesection being done, and looking at that, I did the procedure, venesection, the first venesection. That's how, yeah, that's how most of things will be done. Okay, so what I'm telling is, this may not be the right way, but if the situation demands, you should go to that extent also to save some lives, or to do the needful at that moment. You can't say, I have not done, I don't know, I can't do. No, nobody else is there, and a patient needs to be saved, means you have to go any extent to save the patient's life. So what I can say is, whenever you're free, you may not be able to study much during your clinical like wards or OPD and all. What you can do is watch the videos, short videos, minutes videos, 15 minutes videos. You can watch how to properly insert Riles tube, how to properly catheterize. See, there are so many methods. You don't just blindly follow your seniors or whoever there in the ward, because most of them I have seen in our setup, Indian setup, does in a very aseptic or unsterile manner. Okay, no asepsis at all. Okay, especially in kids and all, asepsis is very important. Okay, this UTI and all very common after catheterization. So learn to do in a very proper sterile, with all the sterile precautions, with all aseptic precautions, how to put without touching. No touch technique is there for catheterization. If possible, these small procedures also will try to take in further sessions for you. Okay, so how to put it? See from a video and just follow it. Okay, if you know it beforehand, then you'll be very confident to do also. When seniors ask you, you'll not say, I don't know, I have not seen. When you say, sir, yes, sir, I can do, then the confidence on you, the trust on you also increases. Oh, that Aditya, oh yeah, if you say something, he does the work, he knows things. So yeah, we can trust him, and we can give the responsibility to him, and we can go. That will be the senior's attitude. That's how you get the opportunities. Otherwise, no one will give directly any opportunities. We should be behind the opportunity. We should grab the opportunities whenever possible. See, you will be made second assistants in surgery. Okay, and sometimes sir will ask, do you want to put the incision? That time you should not like, sir, no, you should not be bewildered. Okay, sir, I don't know, sir, I can't do. Take it the chance, because he has given you, he is responsible. If anything happens, is with some hope or confidence, he has given you that chance. Grab that opportunity, be confident and go for it. If anything mistake happen, it's not your mistake, or no one will blame you for sure. Okay, even they know that you are a trainee, you are just started, you are a beginner. What expected out of you is minimal. So whenever, what I request is, whenever it's possible, grab the maximum opportunity and make the best use of that. Any procedure, be it as simple as dressing. Yeah, I would say, even now I'm doing a cardiac surgery residency. Even now, my patient dressing I only do. Yeah, it is not a simple silly thing to me. It's very important how the wound heals. What if I apply? If I apply betadine, or what should I apply for the wound to heal faster? In for open wounds, what is better? For sloughs, what is better? I will come to know for myself, from my own experience, and patients in front. I need not read some books, or I should not refer anything. From my own experience, I'm learning here. Okay, so we can see the progress in front of our eyes only. So even don't neglect even opportunity to the dressing also. In fact, when I was in Bowring Hospital, I have done hundreds of debridements for diabetic foot patients. I used to love that. Everyone used to leave that diabetic patient. It is so smelly and all, and a lot of slough. Entire limb will be like a necrosed. Okay, so nobody will take up such cases. I used to love, every Tuesdays we had minor OTs. I used to take all the patients to minor OT down, and I used to patiently debride the this thing legs, whatever the wound is there. Okay, so this used to this for soft skills, will develop good soft skills. Okay, the how to that layer by layer you debride, how to hold the scalpel, how to hold the pickup properly. Okay, and when that sloughs goes off and that oozing comes, na, that satisfaction and that itself is different. Okay, what you get, and proper how to do the proper dressing. It can be scalp dressing is different, scrotal dressing is different, the leg dressing is different. How to do that? Will do if you do, it will be effective. All those things cannot be taught or cannot be shown. In fact, it can be learned by own. Okay, so please take any opportunities, don't miss it. Grab the maximum opportunities and make the best use of them. Okay, third thing is performance. Yes, this has got more relevance and significance in recent times. Okay, first thing, as I told, performance with the seniors and consultant. I already told you. Okay, we should have a basic minimum knowledge. More than knowledge, what is expected out of you is the common sense. Here, what's important is a common sense in our see. We might have heard or learned the typical features of pneumonia. Pneumonia patient comes with this fever, give us this thing, breathlessness. No, that's only in textbooks. Only 90% of the patients we have seen present with atypical features only. Okay, most of the patients will present to you with all the atypical, not the textual features, typical textual features, because they come with all the complications on the very late stage. So the what are symptoms we are read and what are they presented with, and not correlate. Still, we should have some sense to think logically. Yeah, this could be this. Okay, and come to some conclusion and do the needful at that moment. Okay, don't expect. This is the one, another suggestion. Don't expect typical or characteristic findings or typical symptoms or the presentation in all the cases in our Indian scenario, at least. Okay, be prepared for that when you start your internship or next in post graduation. So the management with the seniors and professors, you can deal. You know how to deal with that, how to gain the trust, and how to grab maximum opportunities. Second thing is how to deal with the patients. That was one thing I already mentioned. Even in the absence of any seniors or consultants or anyone in the ward, please take care of the patients as if they are your own. Okay, we started the empath society. The empath society is the empathy. Empathy, you know what is empathy? It's different from sympathy. Sympathy is feeling pity for them. Oh my God, what is suffering a lot. It should not be the case with anyone. Let's say sympathy or pity, feeling pity. Empathy is, what if myself or my brother would have been there in that position? What if my mother was suffering like that? What if my own father would have got like that? What would I have been doing? Okay, that's called empathy. Putting ourselves in that position and relating like that and doing the whatever to be done. This is called empathy. This I feel is the most important virtue for any doctor. You need not be a great doctor. You need not be very theoretically very sound. You need to be very skillful. Okay, in our setup or anywhere in the matter, especially in Western countries, it's more. You will realize also soon when you go to the internship, 70% of our patients are just psychological. only 30% of the patient will have any real organic pathology or some functional this thing. The rest of them, all 70% all psychological. They just come with there's a HPD in our syndrome. In our Bowring Hospital, we had a HPD syndrome. Harsha, still you do have this syndrome in Bowring or HPD syndrome? You call it?
Yes, sir.
Huh?
Yes, sir. Yes, sir.
Syndrome. It's called
Hatha Pavadar.
all over the body.
Yes.
These ladies, the homemakers at home, they are fed up for sitting at home. They want to go out. Okay, they will come to the doctors. Okay, they'll complain. Either that, either that, either that, either that. Then one like intelligent fellow will think, oh my God, she's suffering a lot. She's a lot of pain. I should prescribe the very strongest analysis possible. Take this, take this, take this injection. Sister Ji, give her that injection, this injection. Nothing is, even before you would, she's not interested in your prescription. Just she wants something written and she will take it out and go home. Then she will show it. See, doctor prescribed so much.
Correct.
I have so much problems. I want rest. That's the only reason they want. So see, all those things, you can't say it's wrong or right. Okay. Some scenarios, some things are there like this. We should understand this. This is common sense. Where common sense comes into play. So many, like many elderly people comes to you, nobody to listen to them at home. They just come to hospital just to tell their grievances, just to tell their just to talk with you. If you just blast them out, then where else can they go? Instead, just 2 minutes. I know you are very busy, 100 patients to manage. I know, but just 2 minutes spend with such people. Okay, because real patients will be taken care by everyone, by seniors, everyone. But these patients are usually neglected. Just pat around them, just hug them, or just pat at the back and say, or Tata, how are you? Just you had food today. What you had? How are everything at home? And just listen to them. Whatever they're telling, it may not make any sense to you. It may not be fully, totally irrelevant. Whatever they're telling and whatever they're having, just listen to them. Okay, patiently. Okay, and nothing will happen. So just give them two reassuring words. That's all their consoling words. Okay, even though I cannot treat, I'm not a doctor, I'm not big doctor, I don't know treatment. At least what can I do is at least console a patient, okay, and convince a patient, and at least comfort a patient. These three should be done by each and every one of us. I may be very bad doctor. I may not know anything. I may not have any basic skills, but this can be done. Okay, just console with 2 words. Okay, because if a doctor tells no, you are all right, you don't have any problem, that has got much more effect than anyone else telling it. Okay, so they need only, remember, they need only 2 reassuring words from you, some solace, okay, and some comforting by you. Okay, just smile, make them happy for 1-2 seconds at least. Okay, that's the biggest treatment or gift you can give to anyone, by keeping people around you happy. Most of them don't get such opportunities to keep others happy. In your profession, you have got that. You all must watch the recently done video by Chandra Madam in our White Army channel, The Joy of Being a Doctor. She wonderfully enumerated or explained all these things with her own experience. You all must watch that. So please do that. Okay, please never feel we are running out of the time, or we have to see other patients and all. Please don't have such hurry. This is the thing. And 4th thing is what you're all in need of or looking for, and only worried thing in the internship is how to prepare for PG entrance examination. Right? We are not interested in UG learning or in internship anything. As soon as we join to the UG first year, we will be worried only about securing a PG seat. Okay, what is asked in a PG entrance exam is nothing but whatever syllabus we have in the UG only. It's not the social science or some political science or economics. Am I right, Harsha? What is asked in a PG entrance exam is nothing but whatever we studied in the UG only. So we will focus more on it only. And nowadays they have done it nicely. They want to know whether you worked properly in internship or not. Your clinical, especially next, I think, your clinical skills, what have you done in the internship, that will be assessed. Because even if knowing nowadays what's happening, the standards are so low that even without knowing the dose of a paracetamol, we come out as a bachelor, undergraduate bachelors. And what is expected out of him when he comes to the community and starts clinic, if you don't even know the basic paracetamol dose, right? So, okay, so now the standards they've changed the criteria. You should do well even in the internship. Otherwise, what happens, I've seen, especially in the northern states, nobody comes to internship at all, especially in the Delhi and other Rajasthan, other places. Nobody attends internship. They'll be sitting at home and studying, preparing for the entrance exam. At least in South India, we still have the culture. Okay, going to the internship, attending it, learning something. But in most of the parts, it's not there. They'll be worried only about the PG, securing a PG seat. Okay, so they'll be lacking many. I've seen so many of my friends. When they come to the surgery post graduation, they'll be not knowing even to put a simple suture. Leave about mattress and subcuticle. Simple sutures they'll not be knowing. Nobody will be. They'll not even knowing to how to put the catheter. Whether catheter they'll put sometimes in the nose also, thinking that it's a Riles tube. Okay, all these things have happened. Okay, all these I'm not telling just like some jokes or here. All these things have happened. So prepare. How to prepare? How can we prepare simultaneously working as well as studying? Okay, what my idea is, see, for example, you are in medicine postings now. So when you are in medicine postings, the major postings, you need to work a lot. How can you effectively utilize the time is when you are working, work properly. After that, when there is little time, okay, you read that subject, medicine subject. See, three advantages by doing that. You will have a target. Okay, first of all, you will have a target. In medicine postings, I should complete this book along with medicine and dermatology. What are the medicine and allied, what are the branches are there? That I should finish during my medicine postings. That one target, so that you'll finish off. Second advantage is you will be reading that subject only in that particular duration. So many discussion will be going on in the rounds and in the post rounds, and some consultants have the habit of asking everything to the interns. That time, if you're reading, means you can answer better. You can gain that more trust. It will help you to answer better in the rounds and all things. Third thing is, if you come across any doubts, if you have any clarification, if you need any clarifications, if you need any help, anything, your seniors are there, your consultants and there, then and there to help you. These are the three advantages of what I think. If you try to read or try to prepare a particular subject during that postings. Okay, these are three. When you're surgery, read surgery and orthopedics and anesthesia. When you're in a small, like short postings, okay, like maybe blood bank or dermatology or ENT, you can finish up other para and preclinical subjects as well, because ENT may not take you 2 weeks of time to study. It will finish it in 1 week, and remaining 1 week you can complete another pathology or something like that. You can plan accordingly and finish it off. Okay, so this is how. And if you're not able to read the books nowadays, everything is available in fingertips, in the mobiles. Everything's, all the knowledge is available. What you can do is, the best ways to the utilize the time is solve the MCQs. Solve the MCQs as much as possible. It's a soft skill. Again, solving MCQs is not a big big science. It's a it's a purely skill. Okay, it's a purely a skill. It cannot be acquired overnight or in 1 month or 2 months. It comes overnight, like over a long period of time. Okay, what I used to do is, every day I used to make sure that I used to write one like a mock test or grand test, whatever it is. I learned my preparation was just with solving as many mock tests as possible, because at the end of solving, I got an idea how the questions will be asked, how the pattern will be. The question is like this, the answer will be framed this manner. How to rule out the options. All these skills I had in me. Okay, at the end of the preparation, this helped me, because even after so much of preparation, I'll tell you, in my time, out of 300 questions, only 50 questions were there from whatever I read. Rest 250 questions I could manage only by the application like this. Okay, somewhere something I read, and somehow by this may not be the option, this cannot be the option, like that, ruling out things. So that is you cannot finish off reading everything and learning everything. So you should develop these soft skills. Okay, especially of solving MCQ is very, very important. You may have a lot of knowledge, but if you're not able to apply it or use the logic and come to like rule out the options, it's of no use there. It will lead to create more confusion in fact. So this can be, you can use this 1 year of your internship for solving as many MCQ. Don't worry about the results, what's the correct answer and all. Keep solving in your mobile. If you're sitting 10 minutes, I'll solve 10 MCQs now. Okay, anywhere online, so many MCQs are available. Just try to solve it. Just try to solve it. Okay, don't worry about the result, anything. Slowly will improve. So this is about the preparation, and more about this we'll ask from our subject experts also. Dr. Vijay Balaji, are you there? Balaji?
Yes, sir.
Yeah. So can you tell something more about how can we make the best use of medicine postings? How should we come prepared for the medicine post? Some major postings and one of the most important posting where we are learning the most important aspects for our career. So what all you are expected out of an intern to know how we should. No, I'm not a media. I want to be the best intern. Okay, I want to be the best doctor. So what you expect me out of me, and what all I should prepare?
So the first thing is when I just seeing through all after the results, the first thing I got is, sir, how to relate it to the infectious disease. The second thing what you should know is the common diseases. See, as an MBBS graduate, very common is in your family they'll call and ask you. How we say classically, in the previous times, patient will have high grade fever, patient will have weight loss, patient will come with chronic cough. That time is not gone now, because that time you didn't have much facilities. Now the disease spectrum is also changing. So you should have high clinical acumen to pick these things up. So with few questions, you should be able to assess all these things. So that will come only when you start seeing patients. So the more patients you see, so let's say patient comes to you, you will not know at the first. So when you sit in the OPD with your PG or with your consultant, you will definitely not know half of the patients that come to you. So what I would suggest is keep a notebook with you always, a small notebook that you carry. At the end of the day, so as you see a patient, let's say a very peculiar symptom the patient came with. So let's say patient is going to come casualty, you saw a patient, altered sensorium. So you write down the main complaint or what you saw and go back at the end of the day and revisit how to see that case. So take only one symptom per day or one common symptom that you're going to see in your OPD. So headache. Headache is the most common symptom you'll see in OPD. You should try your own framework for headache. You see books and come back and apply that in the next patient that you will see the next day. Otherwise, you will not learn anything. So it will be like, okay, I give Dolo, I give Naxdom, okay, Dolo is not working. Approximate.
Mechanically working, yeah.
So that is not going to help you in any way. So that is one thing. You should always come back and read. So only then you will understand better.
Even in the wards also, if a patient is admitted with one case, read about that case. Okay, how to manage that. Next day in the rounds, it will be discussed. So you can also put your inputs. They'll ask you, Dr. Balaji, how can we manage this? So, sir, otherwise you'll be clueless. Sir, I just admitted. My role is to, I'm an intern. My role is just to admit the patient and write the case sheet. No, that's not like that. The scenario is changing. Interns are equally good, or in fact better than some postgraduates, maybe some junior consultants. So from you also to know the this management and so when they ask you, if you answer, it's very impression. So when you admit to some case, some interesting case, then make sure you go back home and read about that. It hardly take half an hour. You're all bit tired, but this some half an hour extra effort will fetch you so much of happiness next day when you're in front of so many big gathering in the rounds. It's altogether it's a different experience. Okay, that should be experienced. Can't describe it. Okay. Yes, please go ahead, Vijay.
Yes,
very pertinent.
And one more thing is, just don't think that, okay, I'm an intern, I can't do much. Because I've seen, we had a patient, I'll give an actual example. Patient came just with ptosis, non-diabetic. They said it is third nerve palsy. Patient is admitted, started on steroids. An intern was there. He went and asked a little bit history. He said, because as you go through the stages, you tend to skip out on the important steps. Very subtle clue that the patient said was, the intern asked, was there any fatigability? Patient said, maybe, may not be, maybe little in the evening it's increasing. That was a subtle clue. And then the intern came and told back us the next day saying, this is what was there. And then patient was found to have myasthenia gravis. And so even a small thing that you pick up with the history, so it can change the diagnosis so much and it will change the patient's life. So at the end of the day, we are all answerable to our patient. At the end of the day, you ask yourself, what have I done? What have I learned new today compared to yesterday? That's how, that is one more thing. And most important is procedures. You will be doing a lot of procedures. So like ascitic, common procedures is ascitic clap, pleural tap, lumbar puncture. These three things you will be doing. So what I would suggest is you watch NEJM video that is available. You just type on YouTube NEJM and lumbar puncture. Very short, 4 minutes video. Because like Sir was telling, asepsis is very important. Least neglected and most neglected is that. So we just go doing, okay, patient is there. There is so much workload. It's okay, do however you want, get the fluid, send for analysis. So that should not be the case. You will first, our aim is to do no harm. So what we should do shouldn't harm the patient more, and give proper anesthetic. I've seen many times pleural tap when they do, they'll just give little anesthesia and they'll just do it. It's such a painful procedure. Imagine you're having a needle stuck inside your pleura. It's so painful. So like that empathy, you should think that you are undergoing the same procedure. That is one more thing. And make a habit that you have to read every day. Without consistency, you can't reach anywhere. Consistency is the key for anything in life. So be it for your marks, be it for your clinical practice, anything. So every day, make sure you read something 1 hour. So that 1 hour.
Simple funda in internship. You'll spend 2 hours extra in internship every regular studies, or you'll spend entire year later for the PG preparation. Simple. If you read every day 2 hours, okay, put more simple, more extra, you will say one precious year. I'll tell you that 1 year is the worst year of entire medical life. Okay, that way most of you are not experienced here. Don't laugh, Vijay. You have got in not even spent 1 day after the internship. Next day only started post graduation. You don't know that suffering. Okay, that 1 year, like it's a hell of a time. Okay, so please don't go through all those things. So put 2 hours extra time during the internship. That's more than enough. Nowadays, seats have increased so much of PG seats are there, and all it's able. If you just attempt with some minimal preparation, also you'll get through. Okay, you'll get through somehow. You'll get a degree from somewhere. Okay, because nowadays again the DM and MCH also become a must nowadays. So that during the PG times and all, you can prepare better and do your final degrees from the premier institutes or from the best institutes, and be that consultants or in the best possible way. So please, this keep on your mind. 2 days, 2 hours extra every day, or one more year with 16 or 17 hours of reading. Just decide for yourself. Balaji, please.
Yeah. So, and just one more thing, take home would be discuss with your postgraduates. Don't think, through discussion is the only thing you will learn. So discuss with them every case that you see. You ask them, sir, why are we doing this?
Simple. For each and everything, you should ask why. We are scientific learners here. We are not some saints or some philosophers or this thing. We're scientifically learning something. Whatever they tell you, ask them, okay, politely or a very humble manner. Why, sir? Why I am doing this? If you told me to give yesterday you told to give dopamine for that hypertension patient, today you are telling NORAD. Why, sir? Both are in hypertension only. Why you are telling one day, one is like we should know the reason for everything. If you come to the way of management, the way you look at the patient, and your management will be totally different. Otherwise, it will be totally mechanical. I'll tell you why I should be for each and every other reasons. Ask the seniors, or no need to ask also. Nowadays, everything available in the internet. But before asking anyone, or if you feel it's very silly, just Google it. You will get everything, almost all the information. Okay, even silly, if your doubt persists, you can ask any of the seniors or any consultants. Please. Even now, for me, I am also. My father has done like this. I will not do like. I will not follow without knowing the reason. I'll ask him, or I ask my parents or anyone who tells me to do something. First thing is, why should I do that? What's the reason? If I know the see, it's not that I'm giving the back answer to them or I'm being very harsh to them. Just that if I know the reason, if I know the importance of it, if I know the value of it, I can do better with. That's only the intention. Okay. So Balaji has made a very, very important point. Whatever you are doing, especially in the beginning, okay, please make sure that you know the reason for it. Okay. Just like in the negative history, why we were taking negative history, they used to ask in examination, what is the cost for, we ask them why it should be extended, why it should be flexed, why it should together, everything, for every procedure, everything, ask them why it's like that, why it's, or you think for yourself. Please, Balaji, anything else?
I think that's it from my side for medicine.
So from next week, Dr. Ashray Patel, just returned from ICU with a fresh knowledge and experience, who is doing very well in Vani Vilas Hospital. Proud of you, Ashray. Yeah, just recovered from COVID as well. In fact, I should say, Vijay Balaji, just 2 days back, he found to be COVID positive. Okay, he's actually COVID positive, still taking sessions for this, sessions for us. Thank you. And Ashray just recently recovered from COVID. Still had cough, dry cough. Ashray, can you please help us?
Yes, sure. And so coming to pediatrics, internship, we can actually divide it into two aspects. One is neonatology and other is infants and elderly people. So when it comes to neonatology side, the most basic thing you guys need to know is what is a normal neonate. So that is the most basic thing. So if you get to know what is normal, then it is very easy to tell what is abnormal. So like coming to our college only, each intern will be posted to one specific postnatal ward, which will have huge number of babies. And obviously a PG will be taking care of many such wards. So interns will be whole-handedly responsible for one big set of
thalassemia ward. For example, what is telling is, in suppose there is a thalassemia ward, there is 10 thalassemia patients are there. There is a nephrotic ward or some nephrotic extensive CP ward like that. Some 10 patients of each category or each diseases are available there. Okay, let's see. That's what he meant. Okay, Ashray.
Yeah. So what you guys need to learn is picking up the most subtlest of the signs. So what is normal and what is abnormal, to differentiate. Most of the interns, like, they tend to neglect the postnatal wards. They tend to feel it is boring. They tend to feel it is hectic. But that is the most important thing which you are going to face in your future, because NICU care, you guys might not be exposed until and unless you guys are going to be pediatricians. But this postnatal ward care, obviously you will have someone coming up to you, or you will have your own sister's son or daughter. They might come and show to you. So if you are able to pick up at the earliest the simplest of the signs, like not feeding well or the baby being lethargic, it might be a sign of sepsis. So you're saving your own sister's child's life. So get to know what is normal, get to know what is abnormal, and that only comes from observation. Like in our hospital, you guys will be posted for 10 days in postnatal wards, but that is the most important part of your whole pediatrics posting. That might not be so important with the ICU, but this is the most important, and this is where you get to learn the most. So go there, read up read up everything about normal neonate. Like in OP guide, they have given in a very nice manner what is a normal neonate. One full chapter is there. So go through it and know how to observe and pick up all these signs. Next, coming to ICU part, obviously all the interns tend to feel that pediatrics is the most hectic posting. You guys will have a lot of night duties to do. But yeah, apart from hectic, you guys will be doing that just for a month. So come with all the motivation to do. And coming to the ICU, it will be most of the times we'll ask you to monitor. But that again is the most important thing you guys will be doing, because if you are able to pick up even the smallest thing like shock at the earliest, you will be saving that child's life. Like when you have an ICU setup, if there are 40 kids, obviously 1 or 2 PGs who are posted, they will not be able to give equal care to all.
The importance of knowing the normal things. Sometimes the initial shock may be like oliguria, the decreased urine output in children maybe, okay, and some hypotension, mild hypotension will be there. If you pick up it in the early, so for that, first thing what we should know is what's the normal urine output. If you know what's the normal urine output, only then we can tell what is the decreased urine output or the increased urine output. So what is made is a very important point, a valid point there. First, this has been told in the earlier classes also. If not, abnormalities are thousands. We can't know everything. At least if you know one normal thing properly, then we can confidently we can say this is abnormal. Then it's the responsibility of the seniors or the consultants to take care. Our duty is to just pick up those, like you told, monitoring. If any abnormality is there, if anything significant is something going wrong, if you just inform them, then they'll come and manage it. See, that's, as you told, that's the most crucial part. If you pick up in the early part only, it can be saved, or something big mishap can be avoided. If it goes to the last stage, then whoever comes the best of the best pediatrician also can't help the child. So there lies the role of an intern. Monitoring. Don't think that this monitoring, looking at the monitor, is a boring job or tedious job. Nothing like that. We would say the Ramya will tell more about that. What is the how is the internship works, and what is the significance of it. And Ashray, see, what are the procedures we get to do, especially IV cannulation and all, very
coming
difficult.
to the
We only used to
procedure
put
only
that
next.
cannula and all. How can we make it easy for us, please?
Yes. That one, coming to the procedures again. Coming to the procedures, like most of the times, you guys have to come voluntarily and ask us. Like most of the time, PGs might be busy with their own work. They'll end up doing. You guys need to come up voluntarily and telling us that we need to do procedures. So you guys need to show the interest first, and then obviously we'll end up.
I don't know things.
Giving you all the chances. Like you can put IV cannula, you can draw blood, you can put what you can do lumbar puncture. So many procedures will be you can put an UVC, umbilical vein catheter. So all these procedures you can get to do in NICU. So it is just not monitoring. Yes, true. I agree. It is hectic. I agree. It will be a tedious process, but that is the most important part. Apart from that, if you guys come up to us, ask about all these procedures, we'll obviously teach you guys. Correct. So that part as well is interesting. So that is about it. And yeah, one more most important thing, like I've seen many people doing is, like I might not be telling this, do not fake the readings. That doing that will be very wrong on your part, because it tends to become the same job. It tends to become tedious. Many people I've seen that they might end up faking the reading. So please be truthful. Even if you guys forgot to monitor, you guys can come and tell us. But if you guys have written some wrong values, that will be wrong on your part. So be truthful to yourself as well. Then coming to the pediatric side, like as our ex-HOD put in our case sheet, there is wellness visits and the illness visits. So again, over there as well, most of you in your future, you will be more encountering the wellness visits. Like someone will come and ask you about immunization. Someone will come and ask you about your diet. Someone will tell that our baby's head is still not, she is not able to support her head on its own. So is it very late or can we still wait? So these are the basic things. Like one is immunization, second is nutrition, third is development, fourth is anthropometry. So if you guys know these four things well in the pediatric side, it is more than enough. So these are the four most basic things you need to know: immunization, national immunization schedule, and the IAP schedule. These things keep changing, so you guys need to be updated. And it is the most important part, immunization. Next is nutrition. Nutrition, basic counseling of nutrition will help, like how to treat iron deficiency anemia, what are the iron rich foods, what are the vitamin D rich foods. So these are the most basic things which you guys need to know. Coming to the development, all you guys need to know is the fourth table that is given in OP guide: gross motor, fine motor, and the language and the social milestones. So these four things, basic things, and the red flag signs, when till up to what age can we wait. So that is the development part and the anthropometry part. So these are the things which you will be encountering in your future the most. So these are the things which you guys need to be well versed with. After anthropometry,
one more difficult I faced during in the pediatric posting is doses. Ashray, years too many find it very difficult with the dose. Remembering
yes, I'll come to that part.
Please.
Yes. And yeah, after these four basic things, next you guys need to know is about the common diseases which you encounter. In pediatrics, most common disease you encounter is diarrhea. And you guys need to know the IMNCI management, at least, which we read back in our PSM postings, or which we were in our third year. So which we read PSM book, the IMNCI, those flowcharts and tables, we would have tend to ignore it back then, but now you will get to know the importance of it, because any pediatrician or any clinician practicing outside, for that matter, will follow this IMNCI and only then refer to a higher center. So you guys, when you go out of your internship, you need to know when to refer a child. So go through this IMNCI modules for diarrhea and the rest of the things, fever, all those things. Okay. So, and coming to the drugs, as Anna told, it is obviously not possible to remember the dosages of all the drugs, but common drugs like paracetamol or cetirizine, which you give, that is possible to learn. Correct, no? And you can always carry a drug dosage book with yourself. The drug dosage book which we usually follow is Mbbs drug dosage book. all the PGs will have. You guys also can purchase it, as it has not only pediatrics, it has adult dosages as well. So it will be useful forever, I think. So if you just buy that book once, it will be useful forever. Correct? So just buy that one simple book and keep it yourself. So that's all to do with pediatrics, I think. So most basic thing in pediatrics is...
You really scared me, Ashray. We are all not very intelligent or very like...
we too not intelligent.
Okay, we are average students. We can't know that much and all. We can't remember so much and all. Still, we want to do well in pediatrics. Please give some tips, no, please, for the average students. I can't read so much and PSM and I can't read again and come. And
that's
still,
that
what I feel is, see, management, everything doesn't... on total, it's not our responsibility. Especially PGs and consultants will be, don't take it. Okay, he has told the best possible way of doing the internship. Okay, but this is not so in practical. The management part will be taken care by the consultants and the PGs, at least in the initial part. Okay, you will see 3-4 patients, what they manage, how they managing and all. And fifth case or not, will be asked to do all those things. Not like you should be knowing everything from the day zero, and from the day zero you will be asked to do all those things. Management, no. Management is the last thing you will be doing. That too under supervision, or that too under the guidance from the someone seniors. Okay, only you will be doing, only work you will be doing is this admissions, pre-op, like investigations, and what to say, this history and detailed examinations, and taking them for the investigations, and all those, and monitoring part, all those things. Management, don't worry. Okay. That will comes by, like, at the end of the pediatric posting, somehow
pediatric posting,
manage all the cases.
Correct.
That's how you learn. At the end of the pediatric posting, you learn really how to manage it. Not at the beginning. You do not know everything. Don't be scared. Okay. Well, very well said, Ashray. And
I'm going to what I was talking about in IMNC is not about the management. They've given clearly as to when to refer a patient to a pediatrician, or when to refer a patient to a higher center. So when they go out, they'll know when to refer. So what are the danger signs that they need to pick up? Okay.
I can't wait anymore to hear about my most interesting or subject, that's obstetrics and gynecology. Hiranmai, are you there to enlighten us? Dr. Hiranmai? Can you hear? Dr. Hiranmai, are you there? I think. Okay, anyway, we'll connection lost. Okay, anyway, we'll listen to the young energetic Harsha first. Okay, who recently passed the internship and who had maximum work possible in internship, and who has done all the same. Listen to his experience. Okay, and he has managed to study also during the same time. So we will listen to his experience. Dr. Harsha, over to you.
Am I audible?
Yeah.
Yeah. So first of all, I would thank Kishan Rao to have included me in the panel. So I finished the internship like in the month of February. First thing which I would like to tell is this is altogether new experience. Like from being a student, like you will have that feel of becoming doctors, roaming around wearing stats. And you'll get some new sort of attitude and all. It will be a very nice experience to be an intern, especially in like a busy place like our hospital. And so what I would like to tell is that this is a phase where you will meet a lot of new people, different, like your life is going to change, because you will be meeting like the people who are in suffering, then the people who are taking care of them. You will be meeting people who will be taking care of you, that is PGs and consultants. So this is a phase of transition. So you, apart from learning how to be a good doctor, you will also learn how to be a good human being. As Anna emphasized, you will learn about empathy and all. So the first thing is like you will learn, they're going to teach you everything. What you need to do is you must have open mind. Just because someone cleared final year MBBS, then that should not be in our head like we have cleared it and we have done. And whenever some patient come also, we should not be in that thing like they don't know anything like we know, and that shall not be the sort of attitude which we will carry. We should not do that. So
on that, it will be another valuable session for all interns. We'll be starting your PGs will show it on the
so what Harsha is telling
show it
is
on the patient.
yeah, let us not show the same thing on patients, and let us not revert it back to PGs or consultants. Anyone. Okay,
I
please
hope
keep
you are
that
not
in
talking
mind.
about me scolding you during
Coolest PGs I ever had. Like we two were posted, like he had work of both PNC wards and neonatal OPD. So we worked together and it was very nice working with him. And the thing is, also this COVID duties, like you will be, sorry, not COVID duties, night duties, will be sleeping and then suddenly you will be woken up and they'll ask you to do something. So there are many work like that, okay, and many times they'll ask you to like collect the reports. For example, they would have posted a patient to emergency OT and they'll ask you to collect reports and all. Like many patients won't have attenders at times, so at that time, like kindly help them, because you'll be like, oh, I'm doctor, I cannot collect it, I am not supposed to do. No, let's not be like that. Like, let's be empathetic to everyone. Okay, the most important thing in internship is like staying calm under stress. Okay, there'll be a lot of stress, and also it's gonna be one of the like beautiful memories of your life. You'll be making many new friends. Like you will be the one who will be like coordinator of all, because as you work in different departments, you'll get to know the PGs of all departments. So whenever you want reference and all, like it will be the you who can get it done faster, because you will be knowing medicine PG, surgery PG. Okay, ma'am, I'll call and get the reference, like that. So you should be very much active and you should be humble. You should not take stress and don't hesitate to learn any new things. Even if you get some frustration on your part, it's fine. You're gonna help people. And the one more thing which I would like to add is there are few patient attenders, and like so few quarrel might happen, but you should know how to handle it. And what always I suggest is whatever you're doing, let your PGs know like this is what you're doing. Before doing anything, don't take your independent decisions. Let your seniors know, because they are the one who are going to take blame of whatever actions you are doing. So internship is definitely going to be fun. And also like
so many days you're not able to have proper food only because we will be so much occupied night duties and all. We might have forgotten to take food also, and it suddenly 10 o'clock. If you're in Bangalore, okay, you'll go get food at any time. But if you're in some place, how to manage this? One mental stress is one thing. Another, the equally important is the physical health also during internship. You will be so much fatigued and you'll be exhausted. Can you please enlighten that also, please? How can we manage it better? Health part, our own health.
The first thing is like you might not get time to eat on time, but make sure that you eat, okay? And you will be taking care of others' health at many times at cost of your own health, okay? But let that not exploit yourself. Don't exploit yourself. Like you have to take care of your health as well. And one more thing is
what I suggest is, Harsha, what I suggest is about food. Okay, my suggestion, even now I do. My operations get over by 4 o'clock or 5 o'clock. My lunch will be at like morning, no breakfast, because I would have gone to OT at 6 o'clock and come out at 4 o'clock in the evening. I always make sure that if no food available, also at least I carry some fruits or dry fruits, which gives you immediate some carbohydrates and proteins. Okay, something like that, some immediate source of energy, which we can keep in the pocket, bags. Carry something like that all the time. Okay, this is the one is gonna help you. And hydrate yourself. Okay, hydrate yourself as much as possible. Whenever you get to see any source of water, drinking water anywhere, make sure that otherwise you will not separately time to eat, separately time to drink water, separately time to eat. All these things should be done along with watching. Nobody will, no one will tell you go, we have your food and come. Go sleep. If you're got a good senior like Ashray or Balaji, okay, then fine. But all of us will not get like that. Okay. So you should make it, you should plan it such a way that you get some time to see. You are going to bring some report from some blood bank. While coming back, only have 10 minutes food and come back. Otherwise, after coming back, sir, can I go for food? Then nobody will allow you. So you should,
Correct.
all these small things, it may look for long run, it really matters. So these things you should take care of yourself and manage for yourself. Okay. Please take care of that. Harsha, anything important you want to tell?
And one more thing is like you like at many times you will be in such a situation. For example, managing the patient attenders. Okay, like you will be the one who will be like directly involved with the patient. Okay, you will be the one who taking history or getting admitted, whatever. So whenever like a patient attend, like we should know as like how to deal with patient attenders as well, because many times they'll get angry, and nowadays you can see everywhere that assault being done on doctors. So as far as how much ever possible, we have to try avoiding that.
It happens only when you are harsh with the attenders. You're not explaining the prognosis of the. See, suddenly what happens?
Correct.
Patient is deteriorating. You're not communicated anything to the attenders so many days, and suddenly one day you will come out of the ICU and tell your patient is no more, or your patient is sick. They can't accept that fact of the matter, or they can't handle it. Everyone will have a emotional outburst or something. Okay, so for that, how can we prevent all those things? Fighting, sparring is effective communication from the very beginning of the day of admissions. Never give any assurances to anyone. Always be on little on the negative side only. Oh, still patient's condition is not that good. You may require more treatment, more observation and all like that. Be always to make them feel good and all. Oh, patient is very all right. He is very good, fine, doing well. That's required, but not so much of assurances, because see, you give so much of assurances. Yeah, patient will be good only, but when you give so much assurance, suddenly you don't know. One day, suddenly he will collapse. Then if you go and tell that he's collapsed, they will be not in a position to accept that. Instead, you tell some negative aspect, or tell whatever, keep on counseling them in a like a poor prognosis way. Suddenly one day he'll become very good and he will get discharged. Then they will feel real good. Oh my God, his condition was so bad. Doctor used to tell his condition is critical, and now doctor saved him, and is in a very good health condition. So, okay, how effectively you communicate. This is why I used to tell from the beginning, along with the studying, along with all those things, you should develop this habit or skill of communication. Okay, in our profession, like if you ask me, one important thing is good communication skills. Okay, be it with the patient, be it with the attenders, with the nurses. Like he told, we are not. We should keep all the people around us with good terms. You can't quarrel with anyone, because next day nobody will cooperate you. Then your work becomes more tedious and more cumbersome. So you have to, even though if you are having facing some problems from someone, you need to be with good terms with everyone. Try to have good terms with. Don't dare to quarrel or do all those things. Okay, even though you feel like. And attendance management is very, very important. Please do it effectively with good regular communication and effective communication. If you find it difficult, if you're not able to tell it properly, always seek the help of the seniors. Okay, good, Harsha.
Especially in pediatrics, and so it is a very, very delicate part, counseling the parents, because the amount of tension they take is much more when it comes to their own kids. So at least for first 1 week or so, be with your elder professor or the senior most PG who's counseling. Stay silent, observe how they're doing, how they're talking to the parents, and then slowly you guys as well pick up that skill of counseling the patient and patient attenders. Or else most of the times you guys will end up in trouble. Some person might end up physically handling you. So please, in that aspect, be careful.
Okay. So Harsha, any concluding remarks? Any important more want to tell?
So like I would like to summarize everything what I said. So be open-minded, be humble with your seniors, including everyone, let it be nurses or paramedic staff. They are the one, if you want to get work done, you have to be friendly with them. Be friendly with your doctor, them, because they will have more experience than you. they would have more experience than most of the PGs also. So be friendly with them to get the work done faster, and be friendly with the PGs because they are the one who are under more pressure than us, and know how to deal with patient attenders, and be empathetic to your patients and enjoy. Okay, it's not just about working. You'll meet PGs and you'll have outings also. You'll enjoy when let's not consider the COVID situation right now. Even if it's not there, you're gonna enjoy internship. Like you'll have outings and all. Like before COVID started, like we used to go out and all with PGs. Like new friendship we are gonna make. It's gonna be a very fun time. Yes.
Yeah. See, Harsha, you told one. Even now, after so many years, when I enter the hospital, I make sure that I myself wish the security in front and the group Ds who are sweeping there. Even I only wish them good morning, JC, or whatever. Good morning, brother. Okay, security. Because you don't know. Even one day, if the security is not there, you can't work peacefully inside. All the attendants will throng inside, and your will be. So you can't tell only doctor is important in a hospital. Or you just imagine 2 days, your group D workers have not come to the hospital. You can't even step inside the hospital. So you tell me who is important in a hospital, a doctor or a group D?
Everyone.
Okay, so you can't neglect or anyone, like you said, all are equally important. All of us have equal roles to play. So you should respect. Give respect and take respect. It's always like you can't just I'm a doctor, I have studied so much, everyone should give me respect. It's not like that. All are equally good, all are equally good in their own field. So we should mutually respect each other and work in a friendly manner. Okay, that's how work goes very smoothly and in a coordinated manner. Wonderfully said, Harsha. I totally agree with you, and I'll compliment and supplement whatever you said. Very well said, Harsha. It's very valuable inputs.
Thank you.
Hiranmay, are you there?
Hello? Hello?
Hiranmay? Yeah.
Yeah, I'm there. Can you hear?
Yeah, clearly. Can you please tell, this is OBG is a very fascinating posting we'll all be having. Okay, my experience was the best. Okay, I have done 108 deliveries during my 15 days postings. And in fact, I don't feel bad. I hated OBG very much till my final exams got over. Even when the final exams also, when they asked me to show the delivery, I just put the doll inside the pelvis and showed the delivery. I didn't know anything about that. But at the end of the internship, the only subject I liked was the OBG. There's such a divine branch. When the mothers bring that child to you after the delivery and tell you, sir, you did delivery so nicely, you keep the name, or they'll give you some sweet box or some 500 rupees to you, or then they'll tell you, sir, you please hold my son or baby. See, even after doing 12 hours of continuous duty, I would have done 15 deliveries per day. When I'm going at 9 p.m. to the home, I don't feel fatigued, because when I come out, all those patient attendants will be waiting for me to show their babies and to make me hold their babies, to name their babies. Who gets such opportunities? Tell me. No one other than these obstetricians. Okay, great salute to them. Then it's the most hectic branch, no doubt about that. Because being a surgeon, I can take 10 minutes coffee break in between. Okay, but obstetrician can never take any breaks like that. Emergency means real emergencies. They will have their dedication and all next level. Okay, so please, I want to do my juniors to do best use of these postings, please. And also, I want everyone to minimum 10 deliveries also. Please, how can we do that? Please, Hiranmay.
OBG as a posting will have 2 months of posting in internship. And OBG will have OPDs. Mainly, we'll have to see the patients. Follow-up is very important in OBG. Whenever the patient comes for the first time, it's better to know what all the basic investigations and basic advices that we give for patients. Most of them will be very apprehensive, and some of them will be precious pregnancy for them, second or third time, so many about.
Hiranmay, we lost the connection, I think. You have some internet issues? Hiranmay?
Proper follow-up is very important. Hello?
Yeah, some internet issue is there?
Yeah. Am I audible?
Yeah, tell me.
Hello?
Yeah, continue. Hiranmayi.
Yeah, in labor room, especially monitoring is very important to learn how to monitor the laboring case. Hello?
Yeah, continue.
Yeah, like delivery, everybody can do. Even 2 weeks training in normal labor room, even the eye or sister can deliver. But monitoring the case and delivering without any complications is very important. Out of like at the end of the day, you should have a healthy baby and healthy mother. That is what is the fund of obstetrics. Like, yeah, and internship as such will be little irritating and yeah, frustrating in OBG, like acceptable fact. But
Blood, getting blood. So
we should be like how
people.
Harsha said. We should be very calm. Yeah, blood and lighter everywhere, and that smell also. Like 1, 2, 3 days, you will need to get accustomed to that smell only. It happens in PG also, and yeah, people should be calm. Like how Harsha said, he has said rightly actually. You should be very calm with the attenders and the people around you, and that is how they'll treat you back. And even the sisters also. Okay, this doctor is very nice, very sweet. Let us help her. No, whatever the way how you treat them, they'll treat you back. That is
Hiranmayi, I learned conducting delivery from very junior nurse. She taught me.
in
No
OBG
one else
internship.
taught me.
Like how? Yeah.
I learned conducting delivery from a junior nursing staff.
Yeah.
If you are good with them, they'll be doubly good with us. Okay, they'll help us a lot.
Definitely. Yeah. And whatever it is, we should learn from everyone around us. In OBG, like even group D worker will teach you how to work in labor room, and even the sisters around you, even the brothers and the juniors also, like seniors, of course, they are your gods in OBG. And
how to manage in emergency situation. One pregnant woman has come to the casualty with already ruptured membranes or some head is already out. How can we deal in such a, being an intern? How can we attend to such situations?
What is abnormal in OBG? What is going abnormal in the patient? Link. Hello?
Yeah, tell, please.
Hello, is it audible? I think some internet
issues
issues
there.
there.
Can you please tell the most important, like summarize the whatever you want to tell, please?
Finally, like mainly we have what is abnormal, which will be going bad with the patient, like be it even the blood pressure or pulse rate, even BP, which can be a very small thing, like for hello. I can't. I think the voice is breaking.
Yeah. Understood. This is the same thing. Yeah, already Ashray also told that monitoring is the importance of monitoring in the both pediatrics and the obstetrics. It's the same. There's a small subtle features. If you find out in the initial phases, we can avoid
when we see the case, it is easy for us to go back and.
Yeah. Okay, Hiranmayi, thank you so much. And last, to make it more interesting and to have a good entry for the internship, we have Ramya Nadik with us, of the consultant ophthalmologist and also fellow in retina now, retinal surgery. Ramya, Dr. Ramya, please.
Yes.
Ophthalmology person and also all the other short postings also. How can you make effective use of them, please?
Okay, thank you, sir. First of all, hearty congratulations to all the new doctors in-house. Warm welcome to our fraternity. I think I would not be wrong if all of us in this panel and even otherwise would agree with me when I say that the internship is the golden period of any doctor's life. Exactly. All of us will agree that, because it is that 1 year where you are exposed to all subjects, all kinds of patients, and the joy that you get because all the 19 subjects what you have studied, you are actually living it. And that will not happen anytime before or anytime after your internship. So that is an experience in itself, and everybody cherishes their internship experiences the most. And I think it is a very overwhelming, fact for me today, especially today on this platform with one of my juniors, two of my interns, and one intern of my intern, all of them sharing the same platform with me. And it gives me immense joy to be with them and, hearing them speak, and so, so on point. And you feel that, okay, I have been a part of their success stories as well. So that gives me immense joy. While listening to all of the speakers today, there was a one common point that we have to learn from everybody. So that reminded me of an anecdote of my own internship, which I think I must quote here. We learn from our seniors, we learn from our teachers, we learn from our surroundings, everybody. But I had an incident where I learned from a patient. Where I think it is very right to say that an old patient, that is a patient who's coming chronically, is much more better than a new doctor. So there was an incident where like suddenly, I don't know, they just told me, okay, do this dressing, do this, and just everybody just disappeared. And then even if you've read things, even if you've gone through things, and even if you know certain things, this happened with my first delivery as well, like OBG as well. Like they'll just tell you and then they'll go off and you have no idea what to do next. So I clearly remember this dressing because it was a patient of a venous ulcer. And literally he was the one who told me, like, he literally told me which one to take first and how the asepsis has to be maintained. And I think that's the best way, the best thing I learned, best way of dressing I learned, because the patient himself told me, like, what you should do, like how you should dress. This is how they've been doing it to me. And so you can even learn from your own patients. If you are very, keen on learning, everybody will teach you. The second most important thing as an intern, like everybody cherishes, is you're the first contact to the patient. You are the very first contact to the patient. That is itself a huge joy and a huge responsibility as well. So there might be instances like where you are in the rounds, and the patient actually tells, I want this doctor to, do the dressing for me. I want this doctor to put the cannula to me in front of your, some 10 seniors in the ward, and the dil mein laddu phoota wala feeling you get is beyond comparison, okay? Because the patients recognize you more than anybody else. That's just because you're spending much more time with them. So cherish all these moments in your internship. Coming to the short subjects per se, I'll keep my talk also very short about it. Let's get some myths busted first. So the very first thing is the term short subject. The very term is short subjects, okay? So there is nothing called as a short subject, number one. If you get into the short subject later on, it is going to be a very long journey. So the only concept of a short subject in MBBS is just for you to have a holistic approach to the patient. That is, these things are the minimum necessary things that you need to know for a holistic approach to a patient per se. So there is nothing called as a short subject or an end branch. Don't go with that kind of a feeling. The second most common myth that interns come with, that the prejudiced mind is, this short subject posting is not going to fetch me much. So this is a very wrong idea, because there are certain things. Now everybody's talked about all the major branches. I'll tell you some few things which only a short subject posting can give you. The very first thing is the exposure. Okay, the exposure. You have not read, believe it or not, be very frank to yourself, you have not learned in depth of radio, psychiatry, derma, ophthalmology, so much in depth, as much as you have learned in OBG, ortho, or pediatrics, all these medicine. So you kind of know what you are going to deal with, and you also know what to expect. But these are the areas where you have not spent much time. So this is a very, very good opportunity for you to learn how the department functions, what the exposure of patients, like what is the common. See, you might just get cataract case for your exam, but that is not the only case that is being seen in the OPD, right? So you get to know what kind of patients come, what is the way the protocols are, like how is the way the treatment processes are, All these things you can get only in your short postings, because I can say a few things like you would have just seen some pictures of this and that, some skin lesion in Davidson or Harrison. But if you go to the dermat posting, you will actually see a patient and that gets etched in your brain. So these things are very important. The exposure that you get as a subject, as a branch, and what you are supposed, if you happen to take that branch, how is your life going to be? All these things can be learned while in internship in that branch itself. So don't think that it's a short subject, it is not going to fetch me much. It is going to. In fact, I feel it is going to fetch more, because that time is the time you're going to actually know what is that branch. Okay, so that is one thing. Second, also know the legalities of the subject. Like I can say in my own subject, that is ophthalmology, I had a very good interns. One is Dr. Vijay Balaji, one is Ashray, who is both of them are here, and I must say a few things what probably they have done. If I've omitted something, please add on. Okay. I think the very first thing you should do as an intern is make your presence felt. The very first day, you are obviously reporting to your HOD. Also go and talk to the PGs or whoever is there around. Make them know that you are there. So that is the only way that they get to, keep seeing your face, hover around them. And then they'll be like, okay, do this, do that. And then once you do certain things, they'll be like, okay, come here, I'll show you this. So this kind of a feeling comes only when you are actively taking part in that, in that subject. I can quote my own interns here who have done that. So see how the department works. Firstly, I think they'll give you some clerical jobs. They might tell you some very small things to do. Don't be under an impression of why am I doing all this. No, that's how you start. So first, when you start taking a visual acuity, be very loyal to every work that is given to you. Very sincere. See, sincerity is a virtue. It doesn't depend on the kind of task. It is there for all the tasks that you do. So I'll tell, like visual acuity, you might feel, oh, what is there? I'll just have to tell them what they're looking. But it has got a very much of a legal aspect to it. So also learn the legal aspects of each of the branches that when you are dealing with. Okay, so this is not taught to us any time in our MBBS. So to learn to acquire things which are not there in the books in your posting. Also, the short postings are the best time for all types of entrance exams. Why I say this is by all means, that is, these are the branches which give you the gala time of your internship. That is, you are not expected to do much night duties. You are not expected to stay for long hours after OPD. You are not expected to come and do, it's based on your interest. You are not forced to do anything. You just have to work on the, the schedule time, probably 8 to 4, 9 to 4, or however your department is functioning. So make sure that that amount of time that you are spending in your OPD or your small branch is very effective, very, very, very effective. Like put in your heart and soul into that. See, it can be a very small thing. Like there are references from pediatrics ward or medicine ward to check for Kaiser-Fleischer ring. So Wilson's disease case. So you're all excited. You'll go to, you'll ask your pedia friends. You'll go see the patient there. You'll do everything. But the Kaiser-Fleischer ring you have to see in ophthalm only. No. So make sure that you follow the cases in all the minor departments as well. That time it becomes a very sound knowledge about the case and also the techniques, the procedures. So in ophthalm, you can try for, if you're a very good intern and you start doing visual acuities and IOPs and syringings and things like that, then the PG starts giving you to do fundus. Okay, you do start doing seeing fundus, start telling me what the findings are. Okay, you come with me to the OT. Okay, you start giving the block also. So it is depending on how much you are spending time in the department. So don't worry that, okay, this is my minor posting, I am supposed to complete so much of studying. You can do that. Once you go at 4.4, you can leave the department, nobody will question you. You can go back and sit and study how much ever you want for your entrance exams. Best part is you can study the same subject and come and irritate your PGs. I read this thing, this is not. So the PG also will be like, okay, wait, I will also search, I will tell you. So make sure that you bring out the best in yourself, your seniors, your PGs, everyone. That way is the way you can, make the best use of these small postings, be it radiology. See, radiology is again a branch which is like tremendously needed these days. So radio postings, dermat postings, psychiatry postings, all these are very, very, very important. Okay, like the things that you might know, learn, it is going to be far more immense. Like I had a patient, when I was in psychiatry posting, I had a patient coming in telling I had headache. I was like, okay, what? One more headache case. Then on slowly asking, you get to know certain things that might bewilder you. Okay. So make sure you spend quality time with your patients, with your seniors, and everybody else.
I want to add one point. You told very important. Why more so? Because these are the common condition we encounter in day-to-day life, especially dermatology. 10 at our relatives messages, my child is having this rash, my brother has this groin rash, scalp rash. Then for each and every small things, we can't depend on others. Okay, so these are the things which we encounter in day to even though you may be a pathologist, even though you may be a radiologist, whatever it is. But despite your specialty, people will ask you about these common conditions. So we should be well equipped with such knowledge. Radiology also, for small X-rays, USG, and small findings, we can't depend on radiologists. We should be in our specialty, whatever there, we should be able to interpret and conclude it. Okay, so to avoid this dependence on other specialties, we should learn this. This, like she mentioned, this is the only possible way in internship. We can learn all the different departments and without any response, like what to say, we are not accountable for anything, but still we can do everything. This is the beauty of internship. We can do everything. We can experiment things. We can try anything. We can do things, but still we are not accountable for anything. Okay. So this is the beauty of internship. So make use of this, small yet effective postings. This radiology, dermatology, and blood bank and all, because totally every day, despite of your specialty, come across these conditions. So we should know all those things. Please don't neglect this. Very nicely said, Ramya. Yeah, please continue.
So yeah, basically you have only 15 days. So think of it, okay? Like even if you waste a day, it is gone. So don't make sure all your 15 days of that posting is very effective, and you learn the department, how it functions, what the subject is going to offer you and to the patient. I would just say that being everybody else has covered everything possible. So be enthusiastic, but don't do things in over enthusiasm as well. You're not accountable, but somebody is. So make sure you've always taken their permission before you venture into something very new into a patient. Always learn from everybody. Be humble, and be good to your PGs and your subordinates as well. Teach your juniors, like your final years or your own college juniors. That is one more effective way of utilizing your internship. You've now seen the cases. You're actually seeing the cases. So go back, and if somebody is asking, sir, this, you have a lot of input to give them also, and that way you are actually learning. And sometimes the questions that people ask you stimulate you to read more about it. Okay, so that also gives you an upper edge. Like you would not have thought of that question. Somebody just asks you, and then you're like, okay, I should have looked at this. So then you go back and then you see, and that is a far-fetched learning, I can say, than than you yourself, just sitting in front of the books and solving some MCQ. I'm not saying that's wrong, but then you should also do these things. So, you are learning everywhere. Also, enjoy your internship. As Harsha told, it is once in a lifetime opportunity. This 1 year is never going to come back. So enjoy each and every day. Make sure it is very fruitful for you, and come out with flying colors. Wishing everybody a lot of success. If anything you need to ask or say, you are very welcome to contact any one of us. I think that should be it. Thank you.
Yeah. Any doubts from the members? Now we'll have an interactive session. You can unmute yourself and ask us directly the question. You need not type it or so. If any doubts, any clarifications, anything, any help you need, just ask the experts or subject experts or anyone here directly. Okay. Please ask us. Come up with it maybe look silly for you, but it may help others. Your doubt may help others. So in that way also you can help. Okay. So please ask some questions.
Meanwhile, I would like to ask Balaji and Ashray. Hello? Yeah, is Balaji and Ashray there? I mean, they were my interns, so I just want to know if you did anything extra, I mean, in your short postings or anything. This is what I know you people did. That's what I just put in.
Pulling your leg.
Oh my God. Yeah.
Vijay, are there any questions in YouTube?
Yeah, there is one question. What is the importance of coaching?
What importance of coaching? Yeah. See, according to us, according to our White Army motto is we give last preference for coaching. Okay, it's not, we are not against anything. Okay, but first is our efforts. Okay, our efforts with we have lost self-confidence. Okay, that's why we all this. Okay, that's all. Okay, with we don't believe ourselves. If we believe ourselves and put our own sincere efforts, everything is possible by us only. But nowadays the trend as itself has changed. Earlier it was, the trend was like those who were weak in studies used to go for coaching. Now it's like if you're not gone to coaching, you are a fool or you are an idiot. You are considered an idiot. Okay, that's the trend. But we can't also help it. When the trend is like that, we can't go against it also. So yeah. Many people now, along with first year MBBS only, same day evening they go and join the coaching classes also. We don't recommend or advertise any coaching institutions or any authors, anyone here. But yeah, it will be useful. Definitely, it will be useful, and they'll tell in a very best of the best teachers comes there, and they'll take the entire concept what we learned in one entire year. They'll teach you in anatomy maybe in 3-4 days. They'll summarize. But for that, to learn that, to grasp that, you should have read first. Without reading one entire thing, if you simply go there and sit there, you will not understand anything, because whatever we will study in 1 year, they will tell in 1 week only the important points on a very in a revised manner. They will tell you. So once read for yourself everything, all the books or the whatever MCQs books there. Then go to, if you attend the coaching, then it will be really useful for you. It will be very effective also. Okay, that's all we can say about the coaching. Yeah, you can go for that.
Sir, can I add a point? Can I add something here? Thing is, because this concept came up, I had few of my friends, like, bunking the clinical postings to attend coaching. So I don't think that is something that is advocated. You can attend coaching, that's your own free will to do so, but don't bunk your clinical postings, because nothing can substitute that. So you can yourself read something at the end of the day, but the patient can't come to your house. No, like tomorrow, okay, I'll sit and do examination later at 10 o'clock. No, you can't do that. So make sure give priority to things like you are getting something in your college right now, do that. And also, if you want to attend coaching, you can definitely do that. That's your personal choice. But don't cut down upon your clinical knowledge because of this.
Okay.
One of the participants came up with a very important question: how to convey the bad news to patient attenders. Again, on that point, that as already told, for first few days of your internship, at least kindly observe how are your seniors or how the consultant is conveying the news or how they're counseling the patients, and then you guys slowly start up. And if there is any issues that needs to be solved, you guys can always approach us or the higher person, whoever is in the department, instead of you guys directly going and solving the issue.
Those are very crucial matters. Okay, those are very crucial matters. Yeah, nowadays you will be made to reveal all those things. That's because nobody wants to take risks, so you will be pushed to tell. Okay, but and we'll also be, sir is assigning a good work, I'll also go tell. Okay, we'll be also in the enthusiasm in the beginning, but it's not a very simple or so simple it is. It's a matter of big concern and grievance. So please take care of your seniors in the beginning at least, and when you're really confident, you can communicate effectively, and you can really show that our intentions were good, but still the baby could not, like the patient could not make it. Only then, when you're up to that level, only then you can take a offer to do all those things. Okay. Till then, please take the help of the seniors. At least in their presence, you can do, even for taking consent for the operations also. You do if everything goes smoothly, no one will be bothered. If one day small thing goes wrong now, that will be everything will be held it will be caught. So okay, please don't consent taking and revealing the bad. Okay, this is a big both are the important concepts in our field. We learn slowly with experience in post graduation and then on. Please don't take these two things lightly. If anyone assigns you this, please take a help of them, or initially, like he told, observe someone doing that. When you're really confident, only then do, and don't directly go and just blab out something whatever you want to tell. Slowly first make them convinced that whatever the best possible can be done, everything is taken care. Even then it's succumbed, like slowly in a graded manner you should reveal that. That is depends on every different situations. It's not a like a pro forma, or it's not a protocol is not there. So it depends on the situation that comes with the experience. But only thing we can suggest is don't take it lightly, and yeah, be careful in that regard. Next question we have is any handbook we have during to carry during the internship. Any handy books which would help us during internship? Balaji, you know any books, or you can suggest any books?
Yeah. So for medicine, I can suggest there is one book called as Oxford Handbook of Clinical Medicine. It's a short, about 200 to 50 pages, and it will fit in your pockets. So whatever patients come to you, you can just see immediately in the OPD itself. He has given a summary of what common symptoms patient will come and how to approach. So that is what one I would suggest. Other subjects,
I think it's there for surgery also, surgery and other.
No need of hand. Everything is your mobile is
the drug dosage
than your any other organs or anything. Or the most thing you use the mobile. Just Google it. Everything is from the textbooks only. The proper section will be taken there and given there. Okay, and multiple options will be given there. Multi images will be given. Relevant images. You can browse through the images. The procedure, if you want, it will be available in the both image form as well as videos, as well as in the written form. Try to read the review articles. Start reading review articles. This may be a little high for your level, but these are really good. Okay, everything from compiled from all the standard books will put in a one article, 1 page or 2 page. That will give you a very good knowledge about the topic or concept. Okay, handy books and all, don't worry. Okay, like you told that drug dosage book. That's one important. Okay, other than that, everything is mobile is more than enough, I feel. Okay, and ebooks, if you have a tab and all, you can carry it whenever you feel like you solve the MCQs or you read the ebooks and all. But carrying a book and all, it will be cumbersome. Okay, and one more important book, none of you mentioned, for those who don't know the languages, okay, of the local place. Please carry handbook for that one. Okay, language of healthcare. Okay, it's come out in all the languages now. Kannada, what is it? Tamil, Malayalam, Bengali. It's coming in other Marathi, Gujarati, Odia, all the language, Telugu. We are bringing out in all the possible languages, Indian major languages. You can use. It's a very 40 pages, very handbook. You can keep it in the pocket, apron pocket. For all the symptomatology, history, taking everything written in the simple language, you can use it. Okay.
And one more important thing, and I forgot to mention, when you guys are prescribing any drug, in case you are not sure of it, please don't prescribe the thing with the drug dosage. Please come up to us, because wrong drug dosages can cause havoc. So please be aware of that as well.
Mr. Look forward.
One more thing, prescription writing. I don't think we mentioned that. Prescription writing is most common thing that interns have to do. They just write this prescription and send. Like, most of the PGs or senior consultants just tell you, okay, give this prescription to the patient. So you should know how to write a prescription, good prescription, okay? Make sure that to be very quickly telling it, make sure you write the name, the MR number and the date, and if it is a topical medication, then which eye to be used, or if it's any other thing, what is the form that they have to use, and the exact timings that, how they have to take for how many days, and keep it in capital letters. If you write cursive, so many people will not understand. And just write 1, 2, 3, and then put a dash so that nobody else adds on something in that prescription and takes some medicine. Down you can put your signature and whatever your seal number is, but make sure that that's a written record and it is a very legal thing. Okay, and tomorrow anybody can go with that prescription and tell that this doctor has given me this. So be very careful about writing prescriptions in your internship.
prescription should be very legible from the beginning itself. Make it a habit. Okay, don't show your handwriting skills there. Okay, just scribbling like this. You don't know the spelling, that doesn't, you just scribble it like that. Okay, only first letter will be seen. It so happened when I was a PG, okay, with my interns, they written some prescription, just 40 mg was visible in that, and that pharmacist gave some pantoprazole. Okay, fortunately he came back to the OPD and showed the drug, then I could change. It was antihypertensive. Okay, even if he had eaten pantoprazole for 2 years, his pressures would not have come down. He would have blamed me for that doctor, what medicines he gave, nothing came down. Okay, so you are responsible for your prescriptions. You will be putting the signature, so write it legibly. If you don't know spelling, just go through it on the doses also, and please write it in a patient friendly manner. That's what my sincere request to you. We have high medical terms, TDS, BD, this time. See, even after 5 years we find it very difficult to understand. Patient, they don't know, like you explain them for 5 minutes, how can you expect them to know everything what we learned 5 years in 5 minutes? So write in a patient friendly manner, thrice daily before breakfast, or twice daily after the food, or the before sleep. Like, it will take you 2 seconds more, but it will be a lot of convenience for the patient. He'll be blessing you so much. Okay, very important point. Right now, please make a note of it.
Also check if you are in the wards, check the patients. See, all these patients will be carrying their tablets with them. So keep seeing those tablets, like, just tell the patient to show the tablets. That way, it's a very easy way to learn the dosages also.
And one more question is, like me only, other two have asked, madam, I was feeling very low and I didn't had any knowledge. Confidence also, I was feeling low when I entered internship. And the main reason of starting, like taking this session also same. Many students are perplexed now, like how can I do well? Like a lot of overthinking, maybe assumptions is there in me. Still, can I do well in internship? How can I cope up? Ramya?
So I will tell one incident. Okay, like I was this PSM posting was my first posting, and the very first day, like I was thrown into one CHC.
That is the reason
and
you made independently run the show.
go to the CHC, and there are no doctors there, and you are like just opening your eyes there, and you have learned very well. You know that okay, this is, I knew properly mechanism of labor, this, that, 100 things. But when you actually see, okay, one patient lying aram say there, and nobody is like literally bothering. Okay, while let me just go see everybody, and then I just palpate, and she's having contractions, and nobody is like bothered at all. So immediately I'm like, okay, fine, this lady needs to be shifted. And then the first thing is like, you don't have anybody above you, or what to do now. See, everybody goes through that kind of a phase where you have that sudden tachycardia, but you are not able to show it. You cannot show it to anyone. Okay, like you know that you are in that trouble, but you cannot show that. So the very first thing is to calm yourself down. Okay, this is the situation. Somehow this will sail through. It's okay. Let me calm down first. So if you calm yourself down, things start coming to you. So you don't have to worry. I remember what I did. I just called my mother first thing. Amma, this is the situation. What do I do? She's like, relax. Okay, nothing will happen. Deliveries used to happen even before. Even now it will happen. So it's okay. So it's a very funny incident to tell. So I was like, okay, fine. Somehow I'll manage this. But help will always come to you. You don't worry about, I am not confident. I will not. The very fact that you should first tell yourself, I am confident enough to do this, that time it will come. It will come. Okay. Somehow you will feel that and the joy after that is beyond words. Like you have sailed through some major crisis, and you'll be like, okay, that's a miracle that happened with me today. So there will be sisters, there will be trained nurses, there will be seniors to you. Nobody is going to put you into an ocean and say, okay, drown. No. When you're in the ocean only, you will try to breathe, and you will try to learn swimming. So slowly it will come. Not that everybody is perfect. So the toddler will learn after, like it will fall and then only walk. No. So don't think about, I'm not confident, I will do the best on the first day. You might be the best outgoing student of your, your medical college. You've got so many medals and everything. You're like the star intern when you enter the internship. But then all these things go through, everybody goes through it, okay? So don't think that I am less confident, I don't know to do this. It will always come. It will always come. You just have to calm yourself, pray God, and then just the very fact that Harsha told, no, be good to everyone. every single person, everyone will help you. So the help will come from all directions like that, okay? So be good to everyone. It will sail through. And you will have your own stories to tell to your juniors next.
Any other doubts? Please ask some doubts also. It will help everyone. Okay. Yeah, this is the one I forgot to mention actually. This is the one I wanted to address also. See, the real problem is, now we were talking in general mostly about the government colleges, government hospital and all. There are some conditions like wherein there is no enough patient input, or if the patients there also only high-fi VIP patients are there, where we interns or junior doctors never get to touch them or do the minimal examination also, or even the only minimal surgeries being conducted. So even the postgraduates will not get chance, leave about the interns. So that's a condition. So still, how can we manage to learn the best and do the best? So that's a doubt. They're very Kavya Kini, I think, one of our students, she asked very good question. I wanted to address this beforehand. I feel, see, there are so many ways of learning. Okay, there are so many ways of learning. It's not need not be always by doing only. We can learn by others doing also, by observing. Keen observation is required. See, there is one anatomy dissection joke also, I think. Okay, about this and all. No, I don't want to mention it now. By how observation is important in our field. Okay. So what you can do is by observing others, how they are doing, how they are suturing, or how they are putting the cannula, or you can watch the videos, or whenever you get a minimal chance, try to do your best then. Before and see what happens in government is the difference between government and private. I'll tell you. The secret is, in government, no one will teach you or train you in a proper ways. You will learn by yourself most of the things. So what happens, initial 10-20 cases, you will be experimenting something, and that will be go wasted in learning only something. Whereas in private colleges or in such colleges, what happens is they'll train you properly. At least they have some important patients, VIP patient. At least initial 2-3 cases, they'll assist you, they'll supervise you, they will guide you. So next, the first case you will be doing only, you'll be doing with the best, well equipped. You'll be knowing the things, so you will be supervised. So this is the difference, the quality and the quantity. You'll be learning in the quality manner. Okay, in the private or in the such setups where there is minimal patients are there, care is good. Okay, in other setup, what happens is so much of quantity, loads of patients. You'll be doing something, but it will be not of much good quality and all. Okay, only so. With 10, I'm doing 10 appendicectomies without any guidance, like a butcher, or with supervision with guidance, I'm doing 1 appendicectomy is almost equal, I consider. So, okay, don't worry about all this. This is just a training period. Okay. Next, see, you are what you want to, like, you didn't get opportunity to do suturing now. Who knows? You may become a radiologist next, wherein you will never require to do suturing at all. So don't worry about the things which are not in our hands. Okay, always be optimistic. Whenever you get some opportunity, try to learn. Don't crib over it. I am not having any opportunities, I don't get exposure, nothing like that. Its destiny is already written for to be the best. Okay, believe in that, believe in yourself. Okay, time will come and opportunity will get. Okay, you will do well.
Okay,
yes,
I just wanted to add a point here. See, there are the number of cases that you're telling, it's minimal. See, every subject has something called as the bread and butter cases. Okay, it is going to come to all types of colleges. Like you might not see hundreds of them, but you will at least see some 10 or 5 of each of those type of cases, these bread and butter cases that we call. So those 5, you make sure that you have seen it perfectly, like in your internship. So even if it is ophthal or anything, you get one proliferative diabetic retinopathy, you're hearing somebody talking about it, make sure that you go try to see, try to use the direct ophthalmoscope, try to use the indirect and learn the maximum out of it. The best example here in our panel is Dr. Vijay Balaji. Okay, I have not seen any other intern coming, running. We have something, Casey, he'll run. He used to use my COPGs, everybody's DO, go to medicine ward, also use that DO. see everybody's fundus, see everybody's this thing. I don't think any intern, would do all such things. So even if you have less patients, doesn't matter, unless you are, literally jumping in and taking initiative to do certain things, you will learn maximally well.
Recently, Amarish had taken one motivation class. He was mentioning about the same. Such non-privileges should be considered as opportunities. Like Ramya told, one patient you have now, it's good only. If you have, instead of 10 patients, if you have 1 to 2 patient, you can examine in detail, you can learn properly, you will get enough time to spend with the patient, everything. Instead, what happens in a hurry, you will in a hurry to examine 10 patients or do 10 patients work. You will not do anything completely or properly. Some superficially you will do, just put the notes in a very superficial manner or examine in a superficial manner. At the end of the day, you will not learn anything. Okay. So instead, you spend the time with 1 patient or 2 patients, do the whatever needful in the proper manner, in a protocol wise, in a proper pro forma, whatever prescribed. You will learn better. That's what called quality. So in fact, you should feel grateful and you should feel good about the condition. What you should feel it as a good opportunity for better learning. Okay, never feel bad about all those things. Good. Any other doubts, or else we shall wind up. Next is this already Venkatesh. I think you just joined. How to prepare simultaneously for entrance exam. This has been in detail already discussed about this. How to prepare for entrance exam. If you missed this, was the initial part of this session. You will get the answer. Any other doubts?
I think one question has been missed. That is how to use PSM postings most effectively.
Okay.
Yeah. So PSM posting is the best posting you will get, because you are going to learn how to deal with every common thing. Okay, like what your neighbors are going to ask, what your parents and family members are, all this is what you will deal with in community medicine posting. Okay, so make sure that you enjoy the most and learn the most in your PSM postings. You will also have your periphery, like rural kind of posting also. So the joy of going to play drinks, it is you will not see that in cities. Okay, so make sure that you do learn every aspect of a community management. Like see, all this disaster management, all the community healthcare. It's very, very important for a doctor to know all of this. Okay, you are given an opportunity to give talks about something. Make use of them. All as we as interns used to perform plays or go and talk to home by home. You go and tell something about certain diseases like malaria or something. Small things. Yeah, it develops your leadership skills. It develops your communication skills. It makes you a good citizen for that matter. Like the responsibility that you have as a doctor in this society. So it's a very good posting to really make sure that you make a difference in somebody's life. So please utilize it. Make sure that you attend all these campaigns and talk to people and educate them about sanitation, cleanliness. All it might sound very silly to you now, but it is very, very important that you do all these things.
Yeah, ultimately you will realize the treatment is the last part. The first part in our best and our profession is this communication skills, leadership qualities, the personality development, that transformation should come within. Okay, only if you are well, you see, ultimately treatment anyone will do. Okay, but the management that you will learn this way only by doing only. No one can teach you. No books can teach you how to manage things. So okay, in practical situations. So this can be, see here, you'll be in PSM and you'll be posted almost independently. So you need to take independent decisions or minimal involvement of the seniors and all. So these are the places wherein you will have a lot of thinking and logical reasoning and all. Like she told, some leadership qualities you will develop. So this is the best posting to work in. So this also make the best use of it. And
one more important doubt on YouTube was how to approach casualty medicine posting. And they're scared of sudden situations, how to approach that. That was one of the questions.
Good question. Again, there also in a casualties, emergency just for the patient or the board signboard only. For us, everything is emergency. For intern or this thing, everything is emergency. So what I say is, our role is in any emergency situation, anything, to have some common sense and do what the most importantly required at that moment. Okay, that's all. You'll be not having any extra burden or anything. Our role is, in any emergency case comes, first thing is to monitor the vitals. Even in the ward also we do the same thing. Even in the OPD also we do the same. The emergency also consider it as the same. First thing we need to do is monitor the vitals, then inform the senior Cs, BPs. That will be done by us only. Okay, interns. The sir is in hypertension. Only you can tell them. The pulse is low volume pulse is there, and peripheral is full. You will tell them immediately that PG or consultant who is there, depending on your minimal findings, whatever you told, they can take decisions. Okay, so decision making and all not will be much on your hands or your part. It will be done by them. But the initial monitoring part, the examination will be done by you, and you should be there. The only thing in casualties, you should be quick enough. There's no time to think twice or act. Okay, you should be really doing this simultaneous thinking and acting simultaneously, and do quickly. What are you doing? They take a quick ECG, connect to the monitors, and put a immediately nasogastric tube and put the catheter immediately. All these things should be done quickly. That's all the difference between the ward and the emergency. That's all only. But never panic. Okay, when you panic, gone. Your mental thoughts will block. Okay, you can't do anything. Okay, even if you show it in front of the patient, he'll get more panicked and scared. Okay, so don't ever show your emotions or panic in front of the patients or attenders. Be confident, like they all mentioned already. Try to be cool and composed. Okay, take the call for help who are there nearby, and you start doing your work. When the help arrives, you should be done with your whatever you can do, like physical examination, quick examination, survey, primary survey, and monitoring connection, and the catheter tube, unconscious patient, whatever required, the lines and all, you secure them and keep ready. Then the seniors arrives and they'll take care of the and see, now you're overthinking actually. All these 1-2 times you see now such management, then third time you will only do. You will feel this is nothing. I could have done far better than them. Only in the now, when you think like that, you will feel it's a very big thing. When I am a UG, I used to think hernia surgery or appendectomy is a very big surgery. My God, what they're doing such a great job. When I'm internship, when I made to do appendectomy, then I thought, this is nothing. Even intern, I can do appendectomy, I thought. When I become the surgery resident, then hernia surgery also become nothing for me. And even big surgeries seemed very silly for me. Now I'm doing cardiac surgeries. Generally, surgery looks, I should not say, you give me any surgery, even though I have not done also, I can do now. That's the confidence levels that builds up when you go to the higher levels. Okay, that's why nothing can be learned or done in one day. Okay, so all those things you'll be seeing first, you'll be observing first, you'll be taught at first, and then only you will be doing managing all this independently. No one will ask you to do all those things on the day one or from the first patient only. No one is such idiots there in our profession, at least. Okay, so
no one is going to risk the patient's life in your hands. No, that is also a thing.
Yeah. Any other before I can go with the question, what basics things we should know? Ashray, anyone can answer this before OBG posting? What all we should know? One thing, what I feel is you should know only there also assessment only. The interest what we'll be doing is monitoring the vitals, urine output, and mainly you should know to assess per vaginal examination. There is no hesitations and all. Oh, I have not done. I don't know. Per vaginal assessment, you should know whether the patient is in labor or not. You should be able to assess by per vaginal examination, and again per abdominal examination. Two things very important. OBG. If you don't know anything, also briefs that fundus examination should know whether the head is engaged or not. All links. Second thing is per vaginal examination. In any intern must know. Then same thing all there also, catheterization and IV line securing, monitoring urine output, this, that, and all. Nothing much. These two things practically you must know. Okay, fundal examination. Some you will be made to sit in the OPD. Some follow-up to see the follow-up patients. What are the drugs to be given? How to give all those things you should know. That you will be all be taught, and you'll learn soon. But when you enter, you should know how to do these two. That also you will learn. Nothing to worry. One day, 2 day, you see, you learn everything. Next, anything else? Okay. Yeah, about this entrance preparation and all, we have separate videos by Dr. Vijay Balaji and Ashray, and all separate videos on how to prepare during internship for a PG entrance exam, how to prepare during final year. All those videos already we have done, already available in our channel. All possible like required videos for our UGs are there already in our YouTube channel. So please go through them. Please check the channel once. Please search for them and make the best use of them. That's all we can say. And any concluding remarks by all of you for the interns? It's already late. So quickly, Dr. Ashray.
As already said by Harsha, he summarized his whole journey of internship very well. Be polite to everyone, be polite to your patients, to your seniors, and enjoy the whole journey as such.
Thank you. Dr. Harsha? It's not there. Doctor, are you there, Harsha? Dr. Vijay Balaji. Dr. Balaji, are you there?
There is nothing much to add to this. I think it's a beautiful journey that you undergo, and the joy that you get in internship is unparalleled. You may be a postgraduate, you may be a consultant, but the joy that is there in internship is going to be unparalleled. So make the best use of it. Learn through everything, go through every emotion that is there. It will be a different journey altogether. It is going to be the most memorable part of your entire career.
And by the end of the internship, I think so you people will be the most confident people, because you will be knowing, you'll be having the knowledge of all the subjects in the end.
Yeah.
I think the interns are the most happy people in the hospital. That I keep telling this to my interns as well. Like it is the happy folks that you see in the hospital is the intern, because they are like, I'm fresh, I'm a doctor. That kind of a joy they have. They have a lot of confidence. They are very energetic about everything. So as everybody told, it's a golden era of your entire career, and it's going to be this 1 year. So enjoy it, stay safe, and be happy. Make your parents and everybody else proud. Stay safe.
And one more important, like what to say, in this condition is all of us will be having to do this COVID duties. Some Counsellor has already asked one question: how to keep ourselves? It's a new thing for us, no? How to keep ourselves inside the PPE, wearing for 6 or 8 hours. And all, nothing to, don't worry, okay. Hydration and although important, that will be taken care. No one will be so strict that if you are so thirsty, you should not drink water, removing the PP and all. No one, like it's all just rumors and all. Okay, you can go have a water. If you are really hungry, you can take out the PP and go remove and okay. But still, if you drink a lot of water, also problem. Then you may have to. If you don't drink, also problem. For a surgeon, that is a problem. I stand for a long surgery, 8 hours, 10 hours. I can't drink water also. I can't resist drinking water also. I have not got the answer. What is the like what to do? Anyway, don't about the, like so many people have worked so far. No one have had any issues so far. So you'll also don't face, you'll not have any issues like that. Drink water if you feel like going to washroom. Remove that and go. No one will stop you from all those things, doing all those things. Okay. Your concern, your needs are first, then rest everything will be taken care of. Okay, good question.
Panic, basically.
Yeah, nothing to panic in COVID duties. Only one thing for the interns is take care of yourself. Don't get unnecessarily exposed. Okay, in an emergency, anything. First wear PPE. First always wear the mask and what are that head guards are there? Everything wear. Then only attend the patient at any. They'll tell you during the training only. They'll tell you whatever the grave emergency it may be. First make sure that you wear. We don't like in that situation we can't practically do that, but still during the training time also they'll specifically mention this to you. Wear the PPE first, take care of yourself first. Otherwise, from one patient you may acquire, then you'll be spreading it to 10 other patients. You are the most harmful person. So you should take care of yourself first. Wear PPE, all those precautions you take, only then attend to the patient. Okay, nothing in 5-10 minutes, nothing gonna change much. So
and not
only from all the panelists and all the seniors here, only request to the interns or the juniors here is take care of yourself, because we all had COVID. We are all suffered from COVID. Fortunately, nothing serious happened. Balaji now only is positive. Ashray just happened. I was also COVID positive. She is coughing. Kiran me is also COVID positive now. Okay, so all of us were positive, and fortunately nothing much happened. Okay, it doesn't mean that we can be careless or we can nothing happens. We can just relax like that. please take care. Okay, because long run, what will happen, we don't know. What are the consequences? Equally, we don't know still. Okay, so it's better to avoid getting it. Okay.
And
so
two more things, and one more thing is please get yourself vaccinated as fast as possible. And one more thing is, even this we mentioned
two
for
vaccines.
two vaccines.
One HBsAg vaccination because OBG and all. Okay, you will be delivering some septic patient and all. Second thing is nowadays COVID vaccine. Don't worry about the effectiveness, which vaccine, this vaccine and all. Just get vaccinated twice. Okay, that will,
and
some
you
moral boost
guys
will be there.
Are equally exposed at OPD also, not just during your COVID duty. So even in your OPDs, please wear a HIV kit. Please wear good mask and face shield.
Yeah, to make it more serious, not for you. If not for you, at least for your parents' sake at home, you'll be going back, you'll be having good immunity. So it may not affect you, but you'll be carrying the virus, you'll be harboring virus, and you'll be taking it to home if you're going home, or you'll be going to the hospital somewhere. There, 1-2%, some immunosuppressed, immunocompromised will be there, some kids will be there. They'll get affected. I'll tell you now, that's one of the worst feelings I myself had. I was tested negative. I went home with a negative test report. I was that is what is that recent time it was. Then I went home and I spread to everyone, my father, mother, sister, everyone became. That is the worst feeling one can have. If you yourself suffer also, that doesn't matter. But because of you, someone else suffering now, that's the worst feeling one can have. Please never ever do that. At least for their sake, keeping them in mind, please wear PPE, take wear gloves, okay, and that goggles, whatever available in your setup, or have it for yourself, your own. Okay, nothing gonna make much this thing. So please take the proper precautions. That's enough. Management second, everything will be taken care. Okay, by the consultants. Please take your own care, all the precautions. That's all request from all the seniors. This is the main take home message also of today's session, because you'll all be having one duty which none of us had during internship. We'll be doing one great work. Okay, but be prepared mentally and also that physically also with that precautions. Thank you so much. Had a long time discussion, but it can go on about our own memories. Like you said, we had such a wonderful. Even now, if you ask me one best memory in my medical career, I would say it's an internship. Okay, no substitute for that. Such loving, caring PGs. They used to take us for outing, like you said, every night coffee breaks and parties, every monthly outings, picnics. See, that's all very nice, very memorable time, and you will really enjoy. After 1 year, if you remember those who attended, you will really mail us or message us. Yes, sir, you are right. That time we found some exaggerating, but that's really true. We had a very memorable time during internship. At least 2-3 of you will mail us for sure. Anyway, had a nice discussion with you all. Almost discussed all the important facts. And COVID session separately by an expert. We'll have it on Thursday. Please attend that also, Thursday evening. And this will go on. Our important awareness sessions, clinical sessions will go on. Please keep attending the sessions, present the cases. And if you are in the internship, if you find any interesting cases, photographs, please send us so that we can share it in all the groups and we can mutually learn and exponentially increase our knowledge. Okay, that's how we learn. And some underprivileged students also can learn through. Okay. Everyone never get to see all kind of cases and all kind of to manage all kind of cases. So if you share with them, they will also learn something. That's how our motto should be: help others to help ourselves. By teaching others, by sharing with others, we will only get benefited indirectly. So this is our motto. So any doubts, we'll have regular sessions like this. If any requirement, let us know. We'll bring the best of the mentors possible for that issue, and we'll have a session on that. Okay. And please go through our previous videos also before requesting. Almost everything has been already covered. Please go through them. Okay. And for PG entrance preparation also, all the videos are already available. Please go through them. If you require anything more, any help, anytime, let us know. Okay. That's it. Thank you so much, our own dear Dr. Vijay Balaji, Dr. Ramya, Dr. Ashray, Dr. Hiranmai, and Dr. Harsha. Wonderful time discussing. And all the lovely members and our viewers in our Fight Army. You're always supportive, and you're always motivating us to do more and more and better. Because of you only, we could do this much, not otherwise, for sure. Now we are so much contented that it's helping so many out there, and we are of some use, or we're getting some opportunity to help others. Okay, that's the contentment we have when you do some selfless duty like this. We are seniors, we are bound to do, we are bound to guide. All these are duty, we agree. Okay. But yeah, when some responsible juniors are there, they take our words, follow it, and they get the good results, and they when revert back, no sir, I got 75%, I get 82% just because of listening to this thing. That's the satisfaction you have now. That's totally different. Okay, it's more than our own achievements. In fact, let me be frankly tell, I feel more gratified or contented listening to your achievements or my vital member achievements rather than my own achievements. Okay, here it's the same feeling with all. I'm representing all the core members here. They are working so selflessly. They are also very busy with their own work. It's not that they are very retired in their life and they're sitting at home, have no work, nothing like that. They're also equally busy, but they sleep 2 hours less and they work for you, to help you, to guide you, to make your career smooth. Whatever problems we faced, you should not face. That's all our concern. Okay. Anyway, we can talk all night. Anyway, we end the session. Anything? Let us know. Thank you so much. Stay safe, stay strong. Okay. Stay safe, stay strong. Let's